anatomy portion real quick. Stay in the anatomy real quick and understand that the lymph pipes, the lymphatic system has lymph pipes, nodes, fluid, and let's just do organs. So these are the parts of your lymphatic system. I cannot draw, as you can see. So the lymphatic system is made of your pipes, the nodes, which is what I call the filtering station. That's where the cleanup happens. The fluid itself is part of the lymphatic system, and then the organs that make up the cells and other things. Okay, for the workshop today, we're just going to focus on this. The fluid, the pipe, and the nodes. Okay? Now, I briefly touched into why we need to understand it. It's because if you're planning on doing self-drainage techniques, it's important to understand why you're doing what you're doing. It makes you compliant. It makes you be consistent with what you're doing, and it makes the technique much better. Because if you can understand what you're doing, then you won't have to rely on the handouts that most therapists give you. Now, the lymphatic system drainage technique follows a sequence because the lymphatic fluid follows a certain route. Okay? To understand that route, we have to understand where the nodes are. Now, nodes are everywhere, but there are center areas of the body that really has a lot. Now, there is no number that is like the norm. Every person would have different numbers of nodes in each area. So it's not really so important to understand or to know how many. Just know that there certain areas of the body would accumulate in these areas. Okay, so the first area is the abdominal area. So the acronym I use is ACAI. Abdominal area. If for anyone who has the handout, this is the handout that you would want to be looking at. As you can see in the stomach, there's many green circular things. Those are the nodes, the abdominal lymph nodes. And when we do breathing, those are the nodes that we're stimulating. And that's why when healthcare practitioners tell you to breathe, that's one of the reasons why. We want to stimulate circulation. The next, letter C, is cervical, which stands for the neck area. So right here on the side, on both sides. The third one is axillary or armpit. So right in your armpit, there's lots of lymph nodes for the arm to get that fluid back into the trunk. The last one, I, is inguinal, right here. And that's where the lymph fluid from the legs go up to. Now there's other areas, but for this workshop, I'm simplifying it, and these are the main things we're going to target. Okay? Now, let me see. What can we do about it? Now that we understand what it's for, right? It cleans up our body, it helps with our immune system, it helps us when we're sick. Now, what can we do for it, right? So it does a lot for us. What can we do to help it out? Okay? The first thing is Water, right? That's the first thing. The second and third thing is muscle movement and a little bit of skin stretching, and that's what we call manual lymph drainage. Now, the combination of muscle movement and skin stretching is the best thing, because it can't just be skin stretching. It can just be muscle movement, but sometimes stretching the skin also complements it. So for the next portion, you can use this to take down notes as I go through a very simplified technique or sequence. Okay. If you're at home, please sit on a comfortable chair. The couch is fine if that's all you have, but if you can sit on a dining room chair, that would be better. You can also sit on the edge of your bed if you like. You can also lie down, although I will be sitting up, so it might be easier to just doing it upright as well. So the first is breath work. So you're going to place your hands right by your navel. Relax your shoulders. Keep your chin forward. And just breathe in and then breathe out. Nothing forceful, just breathe in, breathe out. Observe how your belly expands as you fill it up with air, and then it deflates as you remove the air. So remember, as you're doing that, keep breathing. You are engaging your abdominal lymph nodes. Deep breath. Feel your ribs expand. Slowly exhale completely to the point that your navel comes in, and that pulls your belly in, which engages the abdominal a little bit more. Let's do that 2 more times together. Exhale. 1 more, breathe in, belly expands. Exhale. Very good. Now, the next one would be cervical, the neck. For people who have heart issues, please don't do the skin stretch. If you have AFib or heart failure or any neck type of surgery, I'm just going to have you do neck stretches. So we're going to tilt our chin up and down. Notice how the front part of your neck stretches as you look up. That alone will help the drainage system. You do that about 3 to 5 times. Make sure that you're avoiding pain. We don't believe in no pain, no gain. Let's do 1 more. And then down. Now come back to neutral. Keep your shoulders down. You're going to look to one side this time to stretch the front and side of the neck. So turn your head. Once you're at the end, breathe in. Exhale, bring your neck back. Stay on the same side for 3 more times. Turn. Breathe at the end. Exhale. Back. Let's do that 1 more time. Breathe. Exhale. Center. Same thing, other side. Make sure your shoulders are not shrugging. Breathe. Exhale. 2 more. Exhale. Last one. Exhale. Now, for people who want a deeper skin stretch in the neck, Just make sure you don't have any pain. You can side bend. Keep your chin forward. So you should feel a good stretch from your jaw down to your clavicle, collarbone. Come back. And again. If you want a deeper stretch, inhale. Exhale. Back to center. One more. Same side. Exhale. Check your shoulders, pinch your shoulder blades together, reset, always reset. Make sure you're sitting on your sitting bones and not your low back, and other side. Chin is forward. Exhale, come back. Two more. Exhale. Last one. Exhale. Good. For people who don't have any heart conditions or heart rate issues or any previous neck surgeries, you may do skin stretch on the neck. So skin stretch, focus on keeping your palm flat. Okay, we are not pinching. It's different from massage. So keep it light, keep your fingertips light and loose. Just for demonstration, I'm going to show you the skin stretch at the back of my hand. Okay, so you're going to place the palm on the skin that you're stretching, and we're going to do letter C's. Okay, half circle. And you can see that my hand is not going this way. It's not moving. It's stuck to that area that you're stretching, and you're just moving the skin. Letter C. So use one hand, put it on the opposite side of your neck. It's easier for your wrist if you go back and then down to your collarbone. Still focusing on the cervical. You're stretching the skin backward and then down to the center of your trunk. Back and down. Good. If you're feeling some soreness, it means you're going too deep. It really should not feel much. Switch hands. You want to just stay there about 5 to 7 stretches. Push the skin back. Bring it down. Skin back and down. Good. Pretend there's glue on your palm and the side of your neck and it's not moving. You're not stroking. Take a deep breath. Exhale. Now let's move on to armpits. Going back to muscle movement. The best thing to do for your arms is to open up the armpits. So if you're typing all day, if you're watching TV all day, lift your arms up and just open up the armpits so that the nodes can stretch, the lymphatic pipes can stretch, the muscles can stretch, and the fluid will flow. Bring it down. If you're having some shoulder issues, that's okay. Just lift where you can, even if it's just up to here. That's still better than keeping your arms down the whole day. But for those who don't have any shoulder issues, reach up, make yourself tall, because doing this doesn't only stretch the armpit, it stretches all of this, trunk, side trunk, and durobliques. Breathe in at the end, and you're stretching your ribs. Exhale, bring it down. Let's do that 3 times. Forward, reach up. At the end, breathe in. Exhale. Drop your shoulders, keep your neck long. One more time. Forward and up, reach. Exhale. And down. Good. So that's the first part of your armpit drainage. The next part is the skin stretch again. So with the same technique, place your hand or your forearm on your head so you don't have to carry it. And then with a flat hand, place your hand on your armpit. And for those at home, please do them on the skin, not on your shirt. Okay, you want skin to skin contact. Same motion, push it back and then down, back and then down, back and then down. For people who's had surgery here, just be careful. Don't do it if you feel like you're having pain. It's better to maybe ask your physical therapist personally on how to do it. Bring your arm down, switch sides, flat hand, skin to skin, push the skin back, and then down, back, down. Keep your fingers loose. Maybe 2 more. And rest. Take a deep breath. And exhale. Good. Now we go to the last one, which is inguinal. That's your groin lymph nodes. Now the best thing you can do for your groin lymph nodes is to stand up. Stand up and walk, which we don't have to do right now. But if you've been sitting for more than 45 minutes, get up, go to the bathroom, get some water, just walk a little bit. Because when you're sitting, your hips are in this flex position. It cramps up that area where the fluid should go. When you stand, it opens that up already just by doing that. And then when we walk, if you have like longer strides, it stretches that front part of your hip, which opens up the inguinal nodes. Okay? So that's the first tip, to get some fluid going for your legs so that the fluid from your legs can come up to your groin and back into your trunk. If you want to do the skin stretch for the groin, for those at home, you can do this. You're going to have to put both hands on one side right by the crease. So if you want, for those here, you can straighten your leg down so that you can have as much skin-to-skin contact on your groin. You can place one hand on the inner thigh and then one hand on the front of the hip. And it's the same thing. Stretch the skin, but this time we're going up because we're going up to the trunk. So stretch the skin. I'm going to stand just for the zoom. So you're going to put one hand, I'm not tall enough. One hand in front of the hip, one hand on the inner thigh. Stretch the skin and bring it up. Stretch the skin and bring it up. You do that 5 times, and then you switch. 5 to 7. Stretching the skin and the groin. Okay? You can also do it lying down so that your legs are flat. And then you always end with abdominal, which is breath work. So let's do 3 breaths. Exhale. 1 more. Exhale. So that's a very, very simplified version of self-drainage, which combines both muscle activity and skin stretching or lymphatic drainage. Okay, now what else can we do for the lymphatic system? If you print it out, or if you're here, on the last page, there is a handout that I made called Lymph Self-Care. It's this one. So we want to make sure that we are maintaining a well-balanced diet. There is no medication.
Hey there, how are you?
Hello? There is no medication that is specifically for the lymphatic system. No vitamins that I know of as well. At least we don't teach it in the clinic. If there's new research coming up, it has not trickled down to us yet, or it may be in the first phases. Low salt, low fat, and high fiber diet is the best. Everything in moderation. High in carbs can increase fluid retention. So if you know that you've had a little bit more carbs lately, make sure you're drinking enough water and maybe make up for it for the next couple of days. Drinking water throughout the day, I don't think I've emphasized that enough, is very important. I always recommend to my patients to use a straw. So using a straw, I feel like, based on experience, you actually get more water in versus if you're doing this. Because for patients who have issues in the neck, doing this your subconscious will stop you from doing that frequently. So sipping a straw is great. Try to avoid wearing tight waistbands. So if you have like tight jeans or pants that has a drawstring, that may be causing fluid retention for your legs because you want the skin in your trunk to be able to breathe, to have some space. So if let's say you're traveling or you're noticing some leg swelling, try to maybe have looser pants or dresses. Anything tight, like jewelry, may cause some fluid retention. Protect your skin. This is very important for people who's already having lymphatic issues. You want to make sure that you're using a low pH wash or moisturizer. It helps keep the skin resilient and it decreases the risk for wounds. When the lymphatic system of that arm or leg is compromised, it's more prone to skin irritation and wounds. So a low pH wash or moisturizer helps a lot. Now this is very important. Monitor for signs of infection. If let's say you've had surgery or you have circulation issues, if you notice your leg to be red, warm, and painful, please go to urgent care or to the ED immediately. That is a sign of cellulitis, which is an infection of the skin and the fluid in that leg. You will need antibiotics for that so it does not spread. Don't call a physical or occupational therapist for that one. That has to be a physician visit. It's very important. So those are the very, very basic things you can do for your lymphatic system. Now, before we go to the Q&A, I just want to explain the role of therapists in the lymphatic world. So the doctors, because there's no really medication that you can take, there's not much that they can do for you if you're having swelling. So the best thing that you can ask for is a referral to a physical or occupational therapist who is certified in lymphatic. They're usually called certified lymphedema therapists. It doesn't have to be a full-on episode of therapy. If you have questions, those are the people you want to reach out to because they have the most training. Now also, please remember that this is an extra certification that therapists have to go through. So if you're seeing a physical therapist or occupational therapist right now and they're not addressing it as much, it's just because they haven't gone through the training, and the training is an extra add-on after school, okay? All physical therapists and occupational therapists can help you with range of motion, pain management, which is still very important. It is our job now, or us, everyone, to seek out the right kind of help and be an advocate for your own health care. Okay? Because if we wait for referrals that will just come, it might not come. So if you're having symptoms of pain, heaviness, numbness and tingling, or fatigue in a certain body part, or just general after maybe cancer or any kind of surgery, vascular or venous issues, ask for help. Online now, there's so many lymphedema therapists who are giving free education. Reach out to them. And also, I would like to thank all of the lymphedema therapists out there because it's such a hard work, and everyone is so good and helping each other out. So if you have any questions, you can reach out to me or to any lymphedema therapist that you can find online. Okay. Before we go to the Q&A, just real quick, there is a flyer in your folders. In the back, it just gives you a bit of information on what symptoms to watch out for. Let's say you're having scar pain, I said heaviness or tingling. Hormonal changes can also attribute to fluid retention or swelling. Sleeping difficulty or mental or physical fatigue. Those are all symptoms that you might be feeling, and physical or occupational therapy can help with that as well. Okay, there's a few questions that was posted online before I go into the in-person questions. So the first one is a question about self-massage techniques for scar tissue from lumpectomy. So this one's a little bit tricky because it depends on how soon after the surgery. We don't recommend massaging the scar until about 6 to 8 weeks after. So this would be a perfect question, a one-on-one question. The next one is, the question is, my cancer did spread to one of the lymph nodes. Yes, that can happen. Cancer treatment would involve either removing that lymph node, which may or may not trigger swelling. If you're having some symptoms already, or if you're wanting to learn more, then it would be good to do a one-on-one physical therapy or occupational therapy visit as well. And then there's another one that says, I have problem with the right arm. So we would probably need to kind of talk more about that in order for us to give advice, because there's many different issues that can happen in the arm. It can be tightness in the armpit, it can be swelling, it can just be plain weakness. So depending on your symptoms, the advice will be tailored to that. Are there any questions who are in here? Yes.
You tell us about the different places to massage, about massaging the swelling, the second.
Yes, so the question was, we only talked about the major hubs, I guess, the major filter stations. You can actually do self-drainage on the limb itself. I didn't go through that today because it's a bit too much to teach. But yes, part of the drainage technique the therapists give you involves skin stretching the actual limb. Okay, and that would probably require, to teach you, would require a one-on-one visit or consultation. Is there any other question? Yes, ma'am.
No, but you said that there was a sequence to this 1, 2, 3, 4. So 1.
Yes, one would be abdominal, cervical would be next, the neck. Yes, the side bending, and then if you don't have
C.
the C,
And then the under,
and then the armpits, and then the lymph nodes. I mean the inguinal,
Okay.
the groin.
okay.
Now, in some cases, this might need to be interchanged depending on whether you're having problems in the upper or the lower. But generally speaking, if you engage them, it's not going to be dangerous, even if you're not doing it in the specific sequence for yourself. It's not going to be dangerous.
Yes, second one, how long is your session if somebody comes to you for the therapy? How long is that?
So mine depends on how difficult the case is. So I see patients every 30 to 60 minutes, and it really is determined depending on what the evaluation is. For those online, and if you have any questions, it's best to reach me through text because I'm usually with the patient. Or you can email me as well. June at PT Michaels. Or you can text me and I'll give you that information online. Marlene, did you have a question?
You talk about drinking water is probably the most important.
Yes.
You know, they have the pH balance, they have electrolytes, they have all these different types of water, not flavored, but different types of drinking water. Is there a better?
Is one better than the other?
One better than the other?
My suggestion with that is, especially with electrolyte water, even though it's over the counter, right? You can get it anywhere. Your medications, if you do take medications, may be altered with that. So if you're having some medications that you take daily, on a daily basis, before you take any electrolyte drinks or vitamins, even though they're over the counter, always ask your physician first. Because like drinking electrolyte water may alter chemical imbalance, and that can be dangerous. Now, as far as whether alkaline water, I am not aware of it being any different from regular water. I think alkaline water is good for inflammation, like for other people who have arthritis. I've found that, or I've read that it helps decrease joint inflammation, or it helps with it. So if you're thinking along the lines of reducing swelling or inflammation, then alkaline water might give you more benefit. But really, general water would be enough. Yes, and now coffee, I am a coffee drinker. So coffee is a diuretic, meaning it makes you go, okay? It makes you pee more. So please don't count that as water, because you have to replenish your body after caffeine. So tea is also a diuretic. Just make sure that you're drinking coffee and drinking water as well. Any questions?
Might sound silly.
There's no silly question.
About 10 years ago, there were a few magazines that said, if you jump up and down those
Trampolines
that will
help.
get your lymphatic system moving. Is that right?
So the question was, is rebounding on a trampoline beneficial for the lymphatic system? Based on some of my patients, yes. Based on some, it doesn't make a difference. So between walking and stretching and rebounding, I always choose walking and stretching. Always go for active movement versus something that you just do from time to time. So it's all a matter of preference, I guess. You can always try it. Just make sure you're safe. Make sure that the rebounder has something to hold on to. It's not absolutely necessary clinically, because that's not something that I generally prescribe, because not everyone has that right at home. But if you find that you get more exercise out of it, then why not? I always say, try everything, just be safe, and just, if it works for you. If it doesn't, then try something different. That's always I think that's a general rule for all therapists. Now, looking at the time, it's 11:46. I wanted to go over resting safely on the bed. Are the people here okay to stay for that? Yes, okay. So I'm
June,
going,
I'm so sorry to interrupt. Did you want me to go through the questions really quick online?
okay, let's go through the questions first, and then we'll do the positioning last, so that if other people wants to jump off, we'll do
Okay,
that.
all right. And we can quicken this as much as possible, and then
Okay.
maybe people can email you or call you. Is
Yes.
that okay? Great. Okay, so is there any special recommendations for patients whose cancers metastasize to the lymph nodes, but who are now in remission?
So self-lymphatic drainage is just not advisable on active cancer sites. So let's say if you have an active cancer site on the right, lymphatic drainage technique can be performed everywhere else. Now, if there's no active cancer site there, then yes, lymphatic drainage can be performed in that area. Not just that, range of motion is really important, whether it's in the hips, neck. So there's a lot of treatment that can be done for a patient who has completed the full cancer treatment. There's also treatment that can happen during, but it will need to be personalized. It has to be individualized. That's not something I can teach on a general sense.
Okay. And there's a few more. I'll try and get through them really quick. I never sweat. Does it mean I have circulation problems? Who would I see?
I do not think so. That is a question I don't think I know how to answer. If not sweating, okay. So my answer to that would be, if you're not urinating enough, then that would be an issue, I think. That would be definitely a primary care concern, primary care doctor, or if you have a kidney doctor, then you would want to talk to them about that. If you're not sweating, I think maybe you're just, I don't know, maybe you're lucky. That would be a question for a doctor, because honestly, I don't have experience in that one. I'm sorry.
Okay. Are regular massages by a non-lymphatic therapist beneficial?
Yes, of course. General Swedish, effleurage, relaxation massages are very beneficial. My only recommendation is, if you know that you've had or are having symptoms in a body part, then have them avoid that part. Or if you've had a recent surgery and you want to just get a relaxation massage, then just have the massage therapist avoid that part. But yes, you can definitely get that for self-care.
Okay. Are there any precautions for individuals living with MBC and have had DVT and PE?
Yes, there's definitely precautions to that. So DVT is a blood clot. PE is pulmonary embolism, which is a clot that travels to your lung. So that would have to be an individualized treatment. It usually would require a clearance from either the primary doctor or the vascular specialist, but there's still treatment to be done. So just because you've had those complicated diagnoses doesn't mean you cannot participate in any kind of therapy. In fact, those people probably need that the most.
Great. Okay. And someone wants to know about coconut water. How about coconut water?
Coconut water, as far as I know, has general cleansing advantages. I do think that counts for water, yes, better than caffeine. Plain water is still also good. Also, just be mindful about the coconut water that you're getting and make sure that it doesn't have other things in it. So if it has like sugar or other add-ons like preservatives, so then just be mindful about that.
Thank you so much. And then one more, does insurance cover this kind of therapy?
Yes, so physical therapy, occupational therapy, and speech therapy. I didn't mention speech therapy that much because in the lymphedema world, they're not as much as PT and OT, but there's lots of clinics that can treat. Okay, maybe not lots of clinics, but there are some. I know Shabnum Brar, she has a clinic. Her clinic is called Elaj Oncology PT in Tarzana. Providence Mission Hills has lymphedema therapists as well. Providence Burbank has there, and then I believe the Disney Family Cancer Center also has them. There's not a whole lot. There are some sports PT clinics that would have certified lymphedema therapists. The best thing to do is ask if they have a certified lymphedema therapist there. If you're needing a bit more guidance, text me and I'll see if I can find somebody who can help you. I do take patients on a part-time basis. I have a studio in Burbank, and I do take some insurance, not all of them.
Fantastic. Thank you so much, June.
You're welcome.
Who was the one you mentioned from Sana?
Ilaj, ILAAJ.
And we actually have her contact information here.
Yes, she has a flyer here.
Yeah, it's on that round table.
Okay, if anyone wants to stay on for the positioning, please do so. Okay, I'm gonna turn the camera to the massage table. Does anyone want to be a patient? Okay, thank you. What's your name?
Marilyn.
Hi, Marilyn. Thank you so much for volunteering. Okay, resting is equally as important because if we are strained, the muscles that are tight pulls on the skin, which of course keeps your lymphatic pipes crunched up. So resting is very important. Resting in the right position is a little bit tricky sometimes when you have pain. So these are the general positioning guides that I usually teach my patients. Try it at home. If it works, great. If it doesn't, then please just try your best to find a comfortable position. So I'm going to go over lying on your back as well as lying on your side. Okay? So, and then also how to elevate the legs. Okay, so if you have a very thick pillow for your head, that can be a problem because that pushes your neck forward. Okay, so if you want to be slightly more elevated, use two thin pillows and prop them like an incline. And when you lie down on it, you want to make sure that you have the top part of your shoulder onto the pillow. Marilyn, I'm going to have you lie down. Yeah. So if you have it on an incline, then the top of your head will still kind of be higher, and that helps with breathing for some people. But this way, the back of your head and your neck and the top part of your shoulder are all in one plane, and it's not pushing your neck forward. Now, for your low back, it helps to have one pillow on each leg. So usually what we do is just one horizontal pillow, right? It's not enough. So if you fully support, how do you feel? Great, she can fall asleep now. If you unload the leg, enough, it unloads the back. Okay, it lets your back flatten on the surface. And your back won't be hanging, and you can rest, the back can rest while you're asleep. Okay, now if you need to support the arm, I'm kind of a little crazy here. You can prop it on a pillow. Feels good? Okay, I told her to say yes. I'm just kidding. So when you unload the leg, it unloads the back. When you unload the arm, it unloads the neck. Okay, now most people can't sleep on their back, so just lie like this for about 15 minutes a day, just to kind of, it's kind of like an intentional rest for your spine. Try not to go on your phones. You can listen to music if you like, maybe not politics. So you can kind of just rest. Okay, and this is something that you can do for you both your joints, your muscles, and your lymphatic system. Okay, now once you're ready to sleep, usually we're side sleepers. So I'm gonna remove the pillows. I'll show you what I usually recommend. Thank you. Once you're ready to sleep, I'm going to ask you to bend your knees. And then maybe sit up your sleep. And then, so when you're turning, you always want to keep your knees bent, okay? Because if you turn with your legs straight, it twists your back. So you want to go ahead and turn your whole body and face the edge. There you go. Now, you would have to reposition the pillow so that the pillow now goes and fills this gap. Okay, so that your head is still in neutral. If it's too low, your head will turn or tilt this way. If it's too thick, it'll tilt this way. So then you end up with a stiff neck. Okay, so you want to kind of find or position your pillow so that it's just enough to support it. And then lift your top leg, just the top leg. Bend your knee, there you go. And then lift the top leg, thank you. Down here. If you have one of those long pillows are good because if it's just one pillow, it drops your foot. What that does is it rotates the hip, which can pull on the back. So if you're having a hard time finding the right position, support it extra. You feel the difference? Yeah. So that little difference of rotation is a big deal for your hip and your back. Okay? And of course, the top arm will rest on a dog or a pillow.
How about a husband?
How does it feel? So this way, when you're asleep, your body sleeps with you, right? And it's not, you're not waking up like, I feel like I've done a day's work already. And then you want to try to switch sides. You can also place a pillow behind you that kind of supports your back, and that way you're not turning. Okay? All right, any questions about the position?
It's my turn?
Yeah.
Yeah.
Oh, your turn, yeah. Stella, this is your lunch. Thank you so much. All right. Michelle, are there any questions online?
Excuse me, I think there was one more. Let me get back to the everyone page. Does having an adjustable bed a benefit or not? And then there's one more question after that.
Adjustable beds can be beneficial depending on what you have. If it's one that elevates the head, that's great, because other people who cannot breathe flat, then that's good. Now, the one thing I forgot to mention is elevating the legs. So if the elevating bed or the adjustable bed elevates the foot up, just know that sleeping in that position can be straining to the low back because you are stretching the the back of your thighs throughout the night. So what I would usually recommend is elevate one leg at a time. And when you elevate one leg at a time, you're gonna have to buy more pillows because you wanna put 3 pillows on top of each other and support the knee. Because oftentimes what we do is we just do this. Your leg is down here, and the knee is hanging, okay? And that's a lot for the knee. So you want to get more pillows so that the whole leg is on it. Okay, you can even have it like this. So the adjustable bed can be beneficial. Just be mindful that depending on your other body parts, it can give you other problems.
Thank you. And then if you have a second, there's actually two more
Okay.
questions.
For
One
anyone
is, okay. One is, so sorry. Can I do stretching skin if I don't have cancer?
stretching of the skin.
Yeah.
Yes, so the lymphatic drainage, yes, of course. Anybody can do it. There's just some precautions if you have heart condition. If you have heart failure, kidney disease, then you might want to speak with a therapist first. But if it's just for general wellness, yes, of course.
Great. Okay. And is sleeping on your left side better than your right because of stomach drainage? They read that online.
I don't know much about that, to be honest. I would have to look that up if there's actual clinical evidence to that. Depending on where online you read it. If it's reputable, then it's probably true. If it's research, if it's backed up by research. But just be mindful about always sleeping on one side, because then that comes with always putting pressure on that shoulder, on that hip, which can give you other problems as well. So, everything in moderation. You want to alternate. We're not just talking about the lymphatic system. You're talking about your muscles, your joints. Everything has to be taken care of.
Fantastic. That's all the questions over here.
Okay. Do we have questions in person? No.
I have a comment. I can't do the multiple pillows, and I do have a lower back. I sleep on my side, but with just one. I tried like you just did. It's so uncomfortable. I'm not sleepy. I can't do multiple.
It's tricky. It's tricky. Sometimes it works, sometimes it doesn't. Yeah, I'm sorry.
Put one in between my legs to the side. That's kind of a trick. And my pillow also has the little what's that called? For the neck. When I sleep on I can't sleep on my back, but it has the neck.
The neck support.
Indentation, so when you sleep on your side, the neck.
Oh, yeah, it has.
And so my neck is never in pain. I thank God for that pillow. I wish I knew where I got it.
It's usually like a Tempur-Pedic pillow.
Yeah.
Yeah, if you don't alternate between back and side, then that's a good pillow to have. The only problem is if you're also a back sleeper, when you go on your back, it's pretty thick. It will push your neck forward. But if you're just a side sleeper, that's a good pillow. Okay, thank you. Thank you.
Thank you so much, June. You're
Thank
amazing,
you.
and we love you. Thank you so much.
You're welcome. Thank you.